we tend not to at all. But then that occasion it wasn't, if you see what I mean.
Thanks very much.
Thank you. So can I now welcome everyone to this meeting being held in public of Sussex Partnership NHS Foundation Trust. My name is Peter Molyneux and I am the chair of the trust. I would particularly like to welcome Aruna, who is standing in for the interim chief medical officer. Thank you very much for joining us this afternoon. You're very welcome. And I would also like to welcome Simon Blake, who is joining the meeting this afternoon in advance of starting his role as associate non-exec director on Saturday. So just a couple of days early. So you're both very, very welcome. Apologies for absence. I have apologies from Jane Padmore and Claire Wilcock. I am not aware of any additional declarations of interest.
Carrie, sorry, Peter, Carrie sent late apologies. She's unwell.
And Professor Carrie Llewellyn, thank you. Minutes of the Board of Directors held on the 1st
And it's my first meeting.
Is it?
The proper
I'm so
board.
sorry. I'm so sorry, Dinesh. I thought we'd already welcomed you. Well, obviously, we would want to welcome you to your first meeting.
All the way from Hong Kong.
There's no need to show off. Thank you. But so yes, of course, welcome to Dinesh Bugra as well. Thank you. Minutes of the Board of Directors held on the 1st of February. Can I take those for accuracy? It appears that I can. As I've looked at the action tracker, I think we're up to date. Everyone happy that we're up to date with the action tracker? Appears that they are. I haven't had any questions from members of the public. We are looking at ways of trying to attract more questions from members of the public and from governors, but we haven't had any posted for this afternoon. If I could then move us to the chair's report, which I will take as read, but I will draw your attention, as I've just alluded to the board appointments that are in the paper, which, as you can see, is the appointment of Professor Dinesh Bugra for a period of 3 years and Simon Blake as an associate non-executive director, and of Kevin Crowley for a period of 3 years. The Council of Governors did approve the appointment of Joe Larby as vice chair. And we also have changes to the executive team and therefore executive board members. Congratulations to Dr. Colin Hicks, being appointed as Chief Strategy Partnership Officer, and Dr. Peter Aitken as Chief Medical Officer. Funmi Onamuzi will join the Trust as Chief People Officer in April, and Peter will join in May. We really are grateful, but particularly, I think, to Claire, who've stood in as two very, very competent interims and have done a huge amount in the time that they've been both interim CPO and interim CPO. So thank you to both of you for your contribution. Really, really appreciated. Are there any questions on the chair's report? Then I will move to the Chief Executive's report and to the Deputy Chief Executive, Osman.
Good afternoon. Thank you, Peter. Good afternoon, everyone. So I will take the Chief Executive's report as read. I mean, I won't repeat everything that's in the formal for report that Jane prepared before going on leave. And there's just a few brief points I wanted to highlight. Firstly, as we draw towards year end, I just want to acknowledge the continued sustained and significant level of operational and clinical pressure our teams are under, and frankly have been over the course of the whole year. It is challenging, and in those circumstances, our staff are doing an amazing job of trying to provide great care to as many people as possible, as efficiently as possible, but it is clearly challenging. And as we go forward, those challenges are likely to continue. And we know there's been an impact on performance. We know that that's, in some areas, our performance isn't where we would like it to be as an organisation. There is going to be a lot of work for us to do in terms of where we focus our effort and how we're going to improve that. And we've been picking all of that up as part of our operating plan, which is on the agenda later, so I won't go into that in detail, but about how we focus in on what we need to do as we go forward. A couple of points I just would draw people's attention to that are in the main report. We've clearly also, despite all the pressures, the operational pressures that teams have been under, we've also been managing our response to the industrial action, which has taken a number of forms over the last period of time, most recently the junior doctor strike on the 13th and 15th of March. And at the moment, we've got our incident management is managing the process, but we're working through preparations for the next strike in April. So that has taken a lot of effort, I know, from colleagues around this call, and I just want to thank them as well for all the work that has gone into making sure that we continue to maintain as safe services as we can during that period. The annual plan and report are in the document, and we will go through those later. But one of the things I think is really important just to highlight is we've made a really concerted effort about our sustained focus on quality. I know Jane has talked about it a lot at every meeting here, and I think it's just to emphasize that it isn't just in the domain of our chief nursing officer or chief medical officer. We, the whole executive team, take that responsibility, and I think that work is now reflected and coming out in our draft quality plan, which is part of the operating plan documentation and which is on today's agenda. But I think it's just important to highlight that as we go forward next year and we think about how do we transform services, how do we decide what we do, that focus on quality will be at the center of everything, as it should be. And I think we will continue to strive to improve quality, but recognizing that there will be at certain points along the way difficult choices to make. I won't talk too much more about the annual plan. It's on the agenda, but it's fair to say that has also consumed quite a lot of time in terms of our both executive and senior management teams in terms of getting ready for next year. And then finally, just to echo Peter's comments, I know Jane would also want me to thank, and I also want to just thank Claire Webster and Claire Woolcock for everything they have done over the last year in their interim roles. Their commitment and energy and drive have been outstanding, and I just want to give my personal thanks for their support over the last year, and look forward to continue to work with them as we go forward. Peter, over to you, unless there are any questions.
Okay, thank you very much. Are there any questions for the Deputy Chief Exec? Anna.
Thanks, Peter. Just very quickly, a couple of things. One, I'm very conscious that we've got a lot on the kind of on the sort of quality side. I think one thing that struck me from this report was the point from the staff survey about raising concerns about unsafe clinical care. My question is, are we looking at that feedback in detail to see what those concerns about unsafe clinical practice actually are, and then linking that to the work that we're doing on breakthrough objectives? So that was one. The second was a very small thing, but for me kind of signals commitment. In the green plan, we've got quite a lot about rises, and obviously we've been talking about rises for a very long time. Are we ensuring that, in the plans, because obviously we've got huge constraints on the finances for that, but are we ensuring that in those plans we have, for example, not just considered, air heat source pumps, but also alternative energies like solar panels? Because I think increasingly buildings are cutting corners on using those sorts of, because they think, we'll save money, we won't put any solar panels on this building. But I just wondered whether that had been given any consideration. Maybe not for now, but two things that struck me as quite important in this report. Thanks. Thank you,
Anna. Peter, do you want me to take that one first?
Please. Yeah.
So just to say, in terms of the staff survey, we've got the sort of we have the trust-wide results, but we also get the information at a more localized level, and that information has been shared with all our local teams. And we are asked, I think we had quite a lot of discussion about this in the executive team. What is our approach to this? Do we, there's always the risk that you just ask people to come up with an action plan. And I think we agreed that what we needed to do was get a much deeper understanding of actually what is driving those results, and that it's better for us to take a little bit more time to give our teams a bit more time to really understand what is driving in their individual areas that change. And I think we are then going to work through as an exec, what does that mean for us in terms of an actual response to this, rather than just the sort of standardized, here's the checklist of things that we should be doing. I think there's a lot of agreement. We need to take a much more holistic approach, I would say, to this, rather than just the sort of potentially way we've done it. And we will clearly bring that back to the board as well once we've sort of worked through those details. In terms of the green agenda, there is attached to the Chief Exec's report, there is the green update. And I wonder, Chair, if it's okay, we could ask Gurpreet, who's our SRO for it, to just have a couple of minutes and just give an update after we've done any other questions on the Chief Exec's report.
I don't want to pigeonhole her, but I'm guessing Claire might be coming in on the staff survey. So I might go to Claire on the staff survey and then go to Gurpreet on the green plan, if that's right. Claire.
Thank you, Chair, and you guessed correctly. Just to add to the points that Usman was raising, because the staff survey is a slightly blunt tool in terms of trying to get to the bottom of some of the detail, we do spend time triangulating that data with other detail that does come through freedom to speak up, that comes through our staff networks. We look at our sickness and our employee relations data. So we do try to really get a better understanding of what might be driving it, as well as the work that Usman described, which I think will be really important as well.
Okay, thank you very much. That's really, really helpful, Claire. So Gurpreet, you've been invited to comment on the green plan.
Yeah, thank you, Chair. So I'll try to keep it brief and try to respond to the question that was raised. You'll see in the set of papers that we've got an update of the green plan. And recognising this is in the context of the newly developed ICS Green Plan and a sustainability board that has met now for the first time in the ICS. As an organisation, we have made considerable progress against the carbon, against our carbon footprint, and I think it's about 44% reduction compared to the baseline level, which is for 2015-2016. The scale of the challenge does increase quite significantly from here on, and we have 8 work streams that are reported on in the report to give assurance to the board that work has progressed through those particular work streams. The draft delivery plan was discussed at the executive committee, and a final plan will be brought to the board. Just to recognise, in that draft delivery plan, there was wide stakeholder engagement across the organisation to develop it with the view to integrate this programme across the entire organisation. There are significant challenges going forward, the most significant one being around the capital requirements in order to progress the green plan in line with our ambitions, recognising that the capital availability has reduced through the changes in ICS capital. So that is something we're working through to understand how we might push that forward. In terms of specifically around the question around solar panels, that is something that our estates team has progressed significantly across our estate. And I am sure, although I will need to go back and check as to where they are with the RISES programme and where that particularly has got to, and I'm very happy to come back and report on that.
Okay. Gurpreet, forgive me if it's in here, but where does an organisation like ours create the most carbon? What's the activity that creates the most carbon that we have?
Well, interestingly, Peter, for us as an organisation, a mental health organisation, when we compare ourselves to all the various partners within the system, we actually have the lowest carbon footprint across the entire ICS. Mm-hmm. Having said that, of course, we still have to make our contribution to this, in which we are pushing forward through our own sustainability programme board, which has been up and running for some years. Our main components for that are estates and also in terms of our journeys, people using cars, etc. There is an ambitious programme around moving us to a electric vehicle fleet and setting up electrical vehicle charging points across our estate, and that's progressing. Then the third space that we've really got a challenge in is in terms of our operating model for clinicians. So is there a as we move to a more digitized delivery of clinical care, that will have an impact on patient and staff journeys. So it's estates and journeys, really, Peter.
Right. Okay. Thank you very much, Kevin.
I immediately went to an impact to outcome model there about measuring carbon impact versus how we're doing in various departments, but that's probably a little bit too esoteric. My question, workforce, and it's a governance question. So we have kind of the classic lagging indicator of the NHS staff survey, already out of date, but really important detail and granularity in there. I guess it's how we, going forward, look to A, develop the workforce strategy, and B, kind of the curation and kind of oversight of that. And I'm presuming it comes up through the OD, the new organizational development and people subdivision of the quality committee would be the primary route where we get to see a bit of the granularity there. Would that be right? We get to kind of, obviously not direct it, but at least get assurance around that. And I guess the broader question then is how we notice what is happening to our workforce and with our workforce in a more in a less laggy way as we imagine changes and transformations. So kind of two parts there. It's kind of how we keep oversight of it as we make change happen.
If it's, I think, Claire will come in, I'm sure, on the detail. Just I think in oversight terms, that is a big reason for the OD and People Committee, or the subcommittee that we've set up, and clearly then we'll also be following that through in terms of the board as well, Kevin. So that should be where we get that assurance, and that people and OD committee level hopefully get into the space of that's where we take assurance around some of the granular actions and challenge ourselves on it. In terms of the sort of timeliness, I'll go to Claire, if that's all right, who will be much more expert in the answer than I will be.
I can probably get with this around kind of more responsive surveys and more responsive kind of timing, but yeah.
So we, aside from the annual staff survey, what we do have in between that, all trusts are required to participate in is the People Pulse, which is a quarterly survey that takes place. It's much shorter, but it is designed to be, as it describes, taking that pulse. Unfortunately, what we don't have at the moment is a very good take-up of response to the People Pulse, and you could speculate as to the reasons for that. But aside from that, what we do also have is our regular health and wellbeing check-ins with every member of staff every 6 months as a minimum. So that is also a way that we try to keep in touch with where staff are at generally, what their thoughts are, how they're coping, all of those sorts of things.
Can I just suggest, if it's okay, Chair, that I think the quality committee kind of taking that on a bit and kind of just making sure, it's part of the governance anyway, but we probably should be more scrutinous of all of that going forward.
Yeah. Thank you. Joe, did you want to come in? Okay, thank you very much. Thank you, Usman. So I think we're good to see the fact that we're not just going to produce an action plan off the back of the staff survey. We want to get into more granular data, and clearly as we move to the integrated performance report, there are issues there that we'll probably follow through from this part of the discussion, but getting to more granular data and a more localized response is clearly something we welcome. I think the green plan is clearly something that I think is important to staff in terms of this organisation being an attractive place for people to work, and staff will want to see that we're taking zero carbon seriously and that we're actually moving to a meaningful level of digital transformation so that we're actually reducing our carbon and reducing and operating in a way that doesn't generate carbon unnecessarily. Thank you, Usman. Was there anything else on the Chief Exec's report? No. Okay, lovely. Let's move to the breakthrough objective. And I think, Teresa, I'm coming to you. Is that right?
That's right, Peter. Thank you. Can everybody hear me okay?
Lovely.
Yeah, Brilliant. Okay, thank you. So last year or this year, I should say, this year that finishes in a couple of days' time, in fact, we had a breakthrough objective, which was in relation to us having an above national average score for the culture of safety in our national NHS staff survey. So originally, so that's the year before, so 2021, we scored 6 for the NHS staff survey result in the safety domain. The average at that point was 6.2, and our target was that we would perform above average within the following year. We've had that report published a couple of weeks ago, and we've actually performed at 6.1. So we've gone up 0.1. The national average has stayed the same. The highest score nationally was 6.6 and has stayed the same this year, so it remains at 6.6. And the worst score nationally was at 5.8 and has dropped to 5.7. So within that context, and given some of the work that we have been completing in year that you'll find within the pack, actually we've made some progress. That said, there is more progress to be made. What I would like to do now is to talk through the draft quality plan and some of the recommended actions and priorities that we take into the next financial year under the headings of safety and experience and effectiveness. In relation to safety, we will like to set a key priority to focus a review on our management of ligatures across our inpatient wards. We would like to set a priority in relation to the demand for inpatient beds, in as much as they will reduce with more patients having their acute care needs met in the community. A priority around Mental Health Act practice improving, and within that, the development of QI projects to truly address the Mental Health Act practice improvements that we see as themes coming through, a conversation that Kevin and I have started. I can see you nodding, Kevin. And an action, a priority around, whilst we're addressing our transformation plans for long-term sustainability, that we safely manage the care and treatment of people that are waiting for their assessment, and in specifically within the context of CAMS, neurodevelopmental weights, and within ATSs. So just on that point, it's about making sure that we are offering everything that we can to people that are waiting, so that people are able to be safe and know how to contact services if things are declining for them whilst they are waiting, recognising that there are transformation plans that are running alongside that. Still under the umbrella of safety, we have the implementation of the new patient safety incident response framework that we continue with this year. We will be going live in relation to our workings against the framework from August this year. And so that remains in our safety priority planning for this year. I'm going to hand over to Dan, who's going to talk about experience. I'm then going to come back in on behalf of Claire, who can't be with us today, to talk about effectiveness, and then to try and answer the so what question that I know we challenge ourselves with often, as we should. So Dan, if I can come to you.
Thanks, Teresa. So briefly on experience, there are two aspects to this. There's the action we're taking here and now, and there's the broader systemic program of work, albeit one that needs equal focus. The here and now includes responding to what people have told us in the community mental health survey, particularly about knowing, or indeed not knowing, where to get help in a crisis. And we've got a system-wide piece of engagement work happening right now to co-produce a specific response on this. That here and now piece also includes the work we're doing on complaints, which we've discussed previously at board, specifically improving on 3 aspects of quality: tone of voice, timeliness of our responses, and clarity of content with our responses. And we've commissioned an independent review to help us do that, which is happening at the moment. In parallel, we've made a concerted effort to have more conversations with complainants in order to try and resolve complaints much earlier. And we're making progress there. So in the last quarter, we've reduced the number of overdue complaint responses by nearly 50%, though there's much more work for us to do here and it needs sustained focus. Secondly, the broader programme of work I mentioned is around how we give patient care or family experience due profile and focused attention across the organisation and across services. I think we've got some really strong examples of where we do that well within our services, Recovery College being one example. That said, with the expertise we have, and with this attention receiving real focused attention from the board and featuring in our breakthrough objectives, I genuinely think we've got an opportunity in the year ahead to be bold, to learn from the best, both within the NHS and beyond the NHS, about what best practice really looks like, and to be at the forefront ourselves of doing this really well, systematically and authentically. Part of the trick for me is about having the confidence to challenge our own thinking and our own assumptions and our own working practices. So to round off a couple of very specific actions we've been talking about as an exec team on this, firstly, devoting sufficient time together to make sure we've got a genuine collective understanding of the principles of co-production and how we translate those principles into practical action. Secondly, there's a piece around strengthening co-production and experience within our governance structures. And we're doing some intelligence gathering right now about what best in class looks like, again, both within the NHS and further afield outside of the NHS. For me, all of this is about, and I'll quote academic Joseph Raylan here, who I think sums it up really nicely, about demonstrating passionate humility in the face of surprise and contradiction. That, to my mind, is about what listening to patient and family experience is about. It also talks to the staff engagement piece that we were discussing earlier in the meeting. That's a very quick run through on experience. I'll hand back to Teresa.
Thanks, Dan. So in terms of the priorities around effectiveness, we want to establish the Effectiveness Committee. That's about having robust information and ensuring scrutiny of evidence of the effectiveness of pathways and services. It's been a subject of our conversation in the Quality Committee around how do we know that the services that we are providing and the interventions that we provide within our services are effective. And it's about us being really clear on what are the metrics that we use to capture that data, and that we're able to be really agile in the way that we respond to that feedback and that information in terms of our service developments ongoing. It's about ensuring an infrastructure and a culture across the trust of the importance of effectiveness and outcomes, and ensuring that monitoring scrutiny of the effectiveness of clinical services is clinically led and in accordance with best practice and evidence-based practice. So I just want to move on to the so what question. Thank you. So what are we aiming for? Under the umbrella of safety, we're aiming for 0 inpatient suicides. We're aiming for our patients being safe whilst waiting for care and treatment, our patients being kept up to date in communication about their Mental Health Act rights, and that we will this year collate the themes for learning through PSERV. So we recognise that this year we will start to use PSERV. What are the themes that we then pull together this year, and how can that then seamlessly take us into our quality plan for next year? So always thinking ahead around what is it that we need to be capturing this year, and how does that flow into a quality plan for the year after? Dan, did you want to talk to the experience?
Just to add to what I was saying earlier, I know the Community Mental Health Survey is referenced here, and you might say that's rather a blunt instrument to use in terms of measurement. I have a different view on that, and I think it's part and parcel of giving patient feedback due weight, focus, and attention. So one of the things we're doing for the survey that's taking place this year is we're expanding the sample size to give it equal weight to the annual staff survey, so increasing it to 5,000. The other issues that are described there, I've touched on in the earlier segment.
Thank you. And then finally, under the umbrella of effectiveness, so what? So we'll have developed clear ways of reporting on the effectiveness of each of our services. We'll be using that, as I said earlier, to shape service changes and improvements. And we'll link this to quality improvement and how we really, I want to say speed up, but how we roll out even further the concept and the culture of QI through the way in which we continue to develop our services. So we'll have an increased number of QI projects operating across services. Peter, I'll stop there for a moment and take any questions. Thank you.
Thanks, Teresa. Are there any questions for Teresa? Amanda.
Thanks, Teresa and Dan. I guess, I mean, it's great that, on a positive, I find it really great that, there's clear objectives here. There's a lot of thought has gone into it. You're identifying the priorities, and it's great to get to that. I'll be honest that when I was reading it, I was asking myself, okay, that's grand, but what are we actually going to do? What are the actions? What are the changes that are happening on the ground that will actually enable us to turn these words into actions? And you both there in that presentation, I think, gave some good examples of those. So I guess as a result, I was quite interested in knowing where we are already making improvements. What do you think on the ground are the things that are enabling that to happen, really enabling that to happen? And therefore, how do we do more of that to make sure that these priorities and objectives turn into more than words on a piece of paper?
Okay.
Thanks,
Teresa, I suggest you respond to that, and then I'll come back round with some of the other comments and questions.
Thank you. So, Amanda, we have a draft SMART action plan for each of the priorities that we have identified today. I didn't drop that into the pack, rather I've put that into the pack for QC for us to talk about at Quality Committee. I'm very, very happy to present it back here. In terms of some of the work that's already in situ, if I can just talk briefly about the PSURF and the work that's been happening in year on the PSURF. So for example, we already have a patient safety specialist now in post. We have our draft PSURP, so that's the planning for the framework, and policy documentation in progress. We have 2 team planning workshops completed. We're using a QI approach to agree the milestones and the objectives. We've had an internal stakeholder workshop completed to review the planning approach, and we've got further internal and external stakeholder workshops planned. There's much more that I could say on that, but just to be assured that we have SMART action plans for each of these objectives, and many of them too are linked to the staff survey. So how would we know that we are achieving? We will base that on the staff survey score, so that at least that way we have a benchmark to be basing our findings on.
Okay.
Hope that's helpful.
Thank you. I'll move back round, and then we can check on where we've got to. Anna.
So I really welcome this. I mean, it is what it says it is. It's a strategic kind of statement, isn't it, on this particular breakthrough objectives? And I think it sets out really clearly where we need to go. And I think there are other places where the detail kind of emerges. That I had just one kind of question, Teresa, which was about on your so what, which was about we will have an increased number of QI projects operating across services. Now, what we know from quite a lot of kind of discussions at Quality Committee is that we have a pretty low completion rate. So we have lots of QI projects that start, but they don't finish. So I just wonder whether to edge that towards where we want it to be, we say the number of completed QI projects, because I think whilst I can see that beginning something, there can be lots of enthusiasm for that, and it's a good thing, and there's a learning process in there. I think we want to nudge towards the end. But so that, because one of our problems in effectiveness is the metrics and not having the measures that we need to know that actually this is being effective, and therefore we can, we can roll it out elsewhere. So just a very long-winded way of saying, would you be happy to add the word completed into that? Other than that, I think it's really, really good. Thanks.
Very happy to, Anna. Thank you.
Thank you. Joe.
Thank you. This is, I'm really pleased to see this, but questions I have are in relation to, I often think as a board, when we're presented with these things, the thing that I always want to know is, well, where are we at the moment? Because when you talk about effectiveness, it's hard to be able in a year from now as a board to say, well, we have moved forward when we didn't know where we were starting from. So whether it's in here or behind this, I think we need to understand and be very clear about where we are and where we need to get to. Also, I think we need to be, and I think this is echoing Anna's point to some extent, is when are we going to get there? Where are the actual milestones? And when are patients, service users, families and carers going to see a difference in terms of their experience? Because again, I think it's great. We've got the process in place, but I'm beginning to kind of have a sense of deja vu as a Ned of we've been here before. So, where's the sense of urgency? Because reading the papers over the last 2 days, our papers over the last 2 days, the thing that really I'm sort of feel quite depressed by is the mountain that we have to climb in terms of the financial challenge. And so when I look at this, I'm thinking about, so what's our risk exposure here? And how are we going to address that, knowing what, the things that mountain that we've got to climb, and what we've said already about the challenges in terms of what we need to do to protect the aidants, let alone the people that we don't know about. So lots of questions there, and I'm not expecting instant answers, but I just kind of feel like let's have a reality check here.
Thanks, Joe. So I mentioned earlier that we have SMART objectives against each of these priorities, but actually they're not broken down into milestones. So I'll give some thought to at least a quarterly milestone for each of these. Thank you.
I think that would be helpful. Thank you. Kevin.
But first thing to say is I think it really is really good. I mean, in terms of the strategic, implications and objectives, absolutely. I think I'm picking up on and those who've heard me broadcast before on the subject of outcomes and how we get there, it has definitely troubled me for the past 12 months, but I've learned to be patient, and I've learned that it will take time. And there's something around maturity, isn't there? There's the maturity of the collection, collation, and the benchmarking Joe talked about, and the maturity of the organization to collect and triangulate and to have the capacity to do this properly. I mean, definitely, I've read it before, but I think this time with feeling, hopefully, and I guess I look forward to the quality committee in particular, kind of getting into both the experience and the effectiveness as two sides of the same coin, and over the coming year, really getting into it. So that's what I like to say on that. I guess if that's okay, my wider point was that yes, we need to do these things, but we're also doing other things, right? And we're also transforming at scale and at pace at the same time. So there's something for me in the balance of risk here that actually, when we look at our risk appetite and risk tolerance around, yes, patient safety and other things, we need to also bear in mind that if we're looking at community transformation, that certain risks might go up, that safety might become more of a factor. And are we as a board sighted on that and able to encompass the idea that when you align this to transformation, align this to change management, align this for organizational readiness for change, that actually patient safety may well be an issue, and we need to be, I think, decided on that, because we take risks to reduce risk in a way, right? And we if we're strategic about it, we have to be aware of that, I think.
Peter, can I just respond to Kevin?
Please do. That's just
Thank you. I'm nodding because, Kevin, we've had a number of conversations through exec that's similar to the point that you have made, which is we have the transformation plans, we have the work with the system, and actually in terms of the quality plan, we have today's quality, we have today's internal business as usual, we have today's internal responsibility that we have to manage alongside the transformational planning. And so the quality plan goes some way to keep our foot on the pedal and our eyes on the internal management of quality in the organisation.
Even as we navigate the bigger picture, yeah.
Even as we navigate change in the bigger picture.
Okay, thank you. Go for it.
Thank you, Chair. I think the other thing that's worth noting for the board is the changes and developments that happened within our organisation that will support Teresa and the rest of the exec in delivering on the quality agenda. One of them is, for example, the digital team have now created a working setup whereby from our clinical information system, clinicians will be able to message directly to patients in the NHS app for the recording of outcome measures. Patients will be able to record their outcome measures. Those measures will then come straight back into our clinical information system, visible for clinicians for one-to-one care, but also into our reporting platform, so we can look at service level outcome measures too. So that will have a significant impact in this space. The other component is the work that's happening in terms of improving data quality, data standards, and the integration of the multiple systems we use as an organization to collect a range of data from a range of sources, and for us to be able to now move to this year to presenting multimodal data, i.e. data from various different sort of angles around the same problem, which will again enable the quality agenda to move forward more effectively.
Thanks, Gurpreet. Dinesh.
Thanks very much, Peter. Just going, a couple of things that strike me. I mean, document is really to be welcomed. I mean, I think it is about time we had something which we can follow with its ups and downs, and I note the concerns which have been raised. But something that Anna said, it'd be really helpful to know what stops these projects. And is there any way that we can introduce incentives of some kind to make sure that people feel rewarded, that this is not another thankless task that we've been asked to do by people who don't know clinical services, and how do we deliver that? And I agree that with Joe that we could be held hostage to fortune, but unless we, mixing my metaphors, grab the bull by the horns, nothing is going to happen. And we have to really do it if we are going to deliver services that we will be proud to use ourselves. So it'd be interesting to look at what stops them, and are there avoidables or there unavoidables, and how do we tease those out and deal with them?
Okay. Thanks, Dinesh. I'll come back to you in a second, Teresa. I'll just take the remaining questions if that's all right. I've got Dan.
Thanks, Chev. Very briefly, just coming back to Joe's point earlier, it's a welcome challenge, and I'd say that because it's the challenge that the CEO brings to us as a team on a weekly basis. One very specific example I'd give relates to complaints, and I wouldn't claim for a moment that we're where we need to be right now on complaints. We know we have a lot more work to do, but one of the many specific actions we've taken over the last year is that the CEO now reviews every single draft complaint before it leaves the organization. And I just think it's a good example of, if attention is the currency of leadership, it's about where you place your focus and attention as a leadership team. And our collective focus, as Osman was saying earlier, is very much on the quality agenda.
Thank you. I think that's helpful texture to that. Thanks. Nitin.
Thanks, Chair. I think Joe already covered what I wanted to say. It'll be really helpful, and I can only reinforce and reiterate that to have milestones that we could look at more periodically. But that's about it.
That's right. Where are we now? Where are we trying to get to? Where are we in between? Yep. Usman.
I'm sure Teresa will cover some of this. I think it's just worth, I know we're talking about the breakthrough objective sort of strategic review, and I know it's further on in the paper, but I think it is worth highlighting in the 23-24 annual operating plan. In the quality plan there, we have set out in more detail.
Yes.
And I think Teresa has set out in more detail, you know, what are the actual outcomes we're going to be trying to aim for and what are the actual measurements that we're going to use. I think it's a fair challenge about milestones, but I think as we develop the operating plan, we'll put them in. But I think what we've tried to do up front is just sort of give an overview of the process we followed and how we've got there. And then as part of the actual planning process, we try to get much more into the, and I know Teresa has been talking to all of the execs about how we all contribute to this, about those specific outcomes and what are the actual measurements that we're going to use, and that, you know, that SMART objective. So I'll just draw people's attention to that, and we can sort of come onto it maybe in a bit more detail when we talk about the annual operating plan.
Yeah. No, I think we very much take that point, Usman. I think having something that pulls together a small number of meaningful metrics is really important. And of course, there'll be more detail behind, but actually, if we can reduce the number of inpatient suicides, if we really can improve the crisis care score, if we can evidence learning from complaints, if we can increase the number of completed projects, we recognize these will all be worthwhile, endeavors that will take us towards better quality, better experience. I think it's just making sure that we understand whether we're on trajectory and whether we've got a reasonable degree of variation as we're going through the year. I've got Anna and Amanda, and then I'm going to come back to Teresa for a final comment.
Sure. I mean, obviously, we've been talking about this a lot at Quality Committee. So I just wanted to kind of come back, because it feels to me like there's actually quite a lot of detail, and the questions that you're asking, there's quite a lot of detail in the, performance report, and then there's also, as Usman says, a lot in the, proposed annual operating plan. So I think the detail is there. I think this is a high level statement. That's its intention, and I think it's about signalling direction, in language that's accessible, that's very clear about what we want to achieve. And I think the things that you're asking for at the moment are not hidden, but they're elsewhere. So I get that you're saying bring them together, but I think they are there. I just think they're not in this document. And I think the reason they're not in this document is because it's meant to be a high level strategic, this is the direction of travel, which we haven't had before. And I think, I really congratulate the team on getting us to this. I think this is something new, and I think this is something innovative, and I think it is bringing clarity to what we've been doing.
Yeah. I mean, some of the more recently joined board members, we did quite a lot on quality improvement. I think this is the first time we've actually set out what our goal is, where we're trying to get to by 31st of March 2024. So I actually think it's a really, really helpful step forward in our approach to quality improvement. And of course, we need to understand how many completed projects there are. We need to understand, as Dinesh says, why are some projects not getting completed? But I think having this overarching set of objectives is really, really helpful. Amanda?
Yeah, and just briefly to clarify as well, I 100% support that, Peter, and thank you, Teresa, for the detailed answer earlier as well in that discussion. I guess just for me to summarize, I think a lot of what you talked about around the actions, you talked about making changes to people, making changes to process, and utilizing data much, much more effectively. And I guess that's kind of where I was going to in trying to understand what are the key things we're going to change. And I had asked at the time as well about, in terms of assessing, for us as a board, assessing the risk and the likelihood of achieving these objectives, be they quarterly, monthly, or by the 31st of March, is in terms of any feel that you, Dan, or other executive colleagues have for when you've made changes like this before. how effective they have been and helping you, not for answering now, but helping you think about that effectiveness and that continual cycle of risk and where we're prioritizing our time, where you're prioritizing your time and resources.
Yeah. Thanks, Amanda. Teresa, unusually, I'm going to give you the last word.
Thank you. So I think it's fair to say that the quality plan for this year coming is work in progress. The feedback that I've received on this today is really helpful. I've got copious notes. And so what we'll do is we will continue to build on that plan. As Usman and others have said, it's, you know, there is more detail in the annual plan, in the quality section of the annual plan. However, that said, there isn't milestones and there isn't the point about exactly where are we now for each of those key priorities. So that's some of the areas that we will bring in. And I hear Joe's challenge, which is, and I think you said this, Joe, and if you didn't, this is how I internalized what you said, but I think I heard the phrase déjà vu. We cannot be in a déjà vu scenario. And so what's going to be different and how are we going to know that we're progressing? And importantly, how will our patients and their families know that that has been our priority for them? For me, that's probably the most important point today. So thank you all very much for your feedback.
Okay. Thank you all very much. I'm going to move us on to the integrated performance reports. John.
Thank you very much, Chair. I will take the report as read as usual, but I will just draw out a few key areas in advance of any questions, if that's okay. I think the context of which we've been having the discussion this afternoon sets the frame nicely. One of quality as the most important agenda, recognizing though, however, the pressure, the operational pressure and the clinical pressure and the financial pressure within our services. And I wouldn't want the performance report to be seen in isolation. There is a real link through to the quality plan, the annual plan, the breakthrough objectives. There is a golden thread for all of those things to improve and continue to meet our performance targets. So just a few areas to bring out. So you will see in the preamble of the report a description around developing a performance framework and our improvement and recovery processes for 23-24. That is something that we did last year that you'll recall. And again, it's something that we want to repeat with our operational teams to make sure that our recovery improvement plans are meaningful and impactful. Particularly crucial this year as we move to place and how we ensure that our place-based leadership teams and our reporting and our understanding of those processes are embedded within our new structures. Usman mentioned it at the top of the meeting, but I think it is worth reporting again around the level of activity within our acute and urgent care pathway. There is a sustained improvement in our out-of-area placements. However, that is a service under considerable pressure with high numbers of patients waiting to come into hospital. But it also feels important to draw out the correlation between patients who are medically ready for discharge and those patients who are waiting to come into hospital. I know we have talked about it, there's a lot here before, but as you can see in the pack, there is a very significant increase in recent months in both the total number of patients waiting to leave hospital, but the length of time that they are waiting to leave hospital. That is not just a numbers, that is not just a financial issue. There are, of course, all the obvious patient experience and quality aspects to that. Care plans and risk assessments. Again, I just wouldn't want us to focus on the percentage because there is a very clear quality and patient experience angle to that. However, it does also reflect there is some improvement in some areas, not least within adult services, which is an area that we have provided particular attention to. But we are seeing in our CAM services with the increase in caseloads and the increase in activities, a struggle, I think it's fair to say, for the clinical teams to remain on top of the performance in those areas. Related to inpatient care is length of stay. We have two metrics, as you know, around length of stay, one over 60 days and one over 90 days for adults and older adults respectively. We continue to benchmark well. You would have seen that adult length of stay is currently being met. Older adults length of stay is being monitored. I raise those two because despite the challenge that we have around MRFD, we are continuing to focus and do reasonably well around length of stay. And in the spirit of quality improvement, you've heard me talk here before around the length of stay quality improvement plans that we have in place. We took a decision in the executive committee 3 weeks ago to extend that project for a further 6 months. I was going to draw out complaints, but I feel that Dan's done that already. Dan has highlighted the challenges that we have, but some green shoots for improvement. And again, if that is something that we have focused on weekly within our exec committee, and a credit to Dan and his team for the work that they are doing alongside operational services. IAPT access. So we have a number of IAPT targets that you're all aware of. IAPT access is the one that we consistently haven't been meeting. There will be next year or this financial year coming greater attention applied to that by us in the organisation and with our system partners. We've done some work with Niche already in East Sussex. We're developing an IAPT improvement board, which will lead on a system deep dive to really understand the cost and the productivity. And then the final bit is just to draw out, Chair. I know we've had very specific, lengthy presentations through board around waiting times. You'll see the final slide at the end, which really is presenting the end of year position. We obviously had a breakthrough objectives around the numbers of people waiting for over 52 weeks, and you will have seen the total aggregate position on the last slide, which excludes neurodevelopmental waiting times, because we've talked about that before. Can we see our data excluding neurodevelopmental waiting times, because we know that it is such a considerable challenge. Whilst the total number of people waiting for longer than we wish has increased throughout the scale of the year, I think it's important to highlight that without the actions that we would have taken around our IAPT, around our adult eating disorders, around Hampshire CAMS, that position would be far more challenged than it is. I won't go into the finances, Chair, because I suspect that Usman will pick that up in more detail later.
I think they might come up elsewhere, don't you?
I make an educated guess.
Yeah. So, I mean, I suppose to some extent, on the 29th of March, we are where we are at the end of the year. So I suppose, to some extent, this is the moment when we might want to just understand what is it we can learn from the year we've just had. So there is something I think about actually where things have improved. Why did they improve, and what can we learn from that improvement? And then we've got, if you like, some of the more stubborn metrics like medically fit to discharge, like recruitment and retention rates, where we might want to think about, well, is there a different way we need to look at this as we transition from this year to the next? And I suppose the one I thought we should notice is that children and young people's eating disorders has improved from 25% to 75%. Relatively small numbers, but that's a fantastic improvement. But I just wondered whether, why did they manage that? And are there lessons we can learn from where we have managed to make significant improvements?
Thanks, Chair. I'm happy to start on those, and other colleagues may wish to come in. So I think the first is probably around data. So I think your question is, what have we learned, and what is some of our tools and focus for the year ahead? So if I look at our data and our understanding around waiting times, the drivers of waiting times, the level of waiting times within each of those services, the greater visibility and greater understanding, not just here, but throughout the organisation of our data, I think has been one of the most significant changes and tools that's happened throughout this year. If I look at the weekly waiting times groups that have been established during the last 12 months, local teams, frontline staff running and working in those teams, I do not think would have been able to understand and or articulate who is waiting longest, why they're waiting longest, 12 to 18 months ago. So that feels like that's a very different space. You mentioned MRDs, and Usman mentioned it at the top of the meeting in terms of the strategic space that we think we need to be stepping into. And we've talked about this before, particularly in terms of the housing space. So for me, I don't think it is necessarily, we are just going to expect and wait for system partners to deliver it. There is something for us about stepping into that space like we are doing in the housing world. we've learnt a great deal from the length of stay work that we've done. And our great deal from the length of stay work that we've done. And our ambition is to apply similar, I think you have heard me talk about this last time, apply similar in terms of QI methodology from the ground up in terms of waiting times. So at team level, instead of us just prescribing this is what needs to be done, we are asking teams to develop individual waiting times initiatives with centralized support to develop a much greater level of granularity to improvement plan for the year going forward. And eating disorders. You asked about CAMS eating disorders. I met with the eating disorders team yesterday to talk about a number of things: digital solutions, their estate space, but also the clinical oversight they have to the waiting processes. So I think it's a combination of things. I don't think it is one thing. Their level of clinical oversight of their referral activity, the way that they review and work with families and the young people themselves to ascertain the urgency, their processes, their booking systems, their use of the data and the visibility to it. And not least, dare I say, some management oversight and focus. So I think the continued focus, the strength of the clinical voice in that process, and not least the digital solutions will be the areas I think of that we've learned and the focuses for the next year.
Okay, thank you. Usman.
I think John's touched on it. I just wanted to add, I think the lessons to be learned from the patient flow work and that sort of QI approach, locally led, I think, and somebody mentioned it earlier, I think it was Dinesh, in terms of incentivization and how do we get those QI programs to work. I think that a different approach we took with these programs was actually just getting out of the way, if I can be a bit frank about it, which is we let local teams with a bit of support get on with doing something, and we made it clear to them that we were interested in what they did and what they achieved, but we didn't necessarily tell them what to do or how to do it. So I thought there was something to learn there, but I also can't shy away from some of the improvement we've achieved has been where we have better data now and we focus on it, and we go into I think we're probably use a performance management framework more effectively perhaps as we've gone on through this year, and that's something I think we're going to have to learn and continue to develop as we go into next year, because the age old of where we put our focus as execs sometimes does result in some change. So I don't think it's an either or, but I think it's a balance of both of those things, both the local led as well as our role in terms of that PM framework.
Okay, are there any other questions for John, recognizing where we are at the end of the year? Joe.
Yeah, and this isn't expressly for John, but I think it's it's one of the key areas in here in terms of the difficulties around discharge, and quite clearly the ability to address that problem and find a solution isn't solely in our hands. And given the role of housing, the local authorities, where are we in terms of beginning to develop the sort of focused approach with those stakeholders in addressing this problem? Because I know that lots of local authorities say that they don't have the resources, but in fact, when we go relate this back to our financial position, it's a hell of a cost not being able to discharge people, and the impact that has on the other things that we need to do. So where are we in terms of addressing that local authority and others' relationship in terms of creating the services in the community that will enable us to discharge according to the patient's needs?
So Joe, just before I let that question go out, so Jane and I had a conversation about looking at, once FUNME has landed, having another conversation about retention, because that's a key area for us, and we want to celebrate the fact we met the target, but we don't want to normalize a target of 15%. I think the other bit is the MRDs, and we were going to bring the housing work and the MRDs to the 3rd of May board strategy session. So we were going to do a deep dive on the 3rd of May. because it feels like that's another area that we've just got to reframe and have another look at. Would it be okay for today if we put that question at the beginning of the 3rd of May?
That's fine.
Okay. Thank you. Any other any other questions on the integrated performance report? Okay, so I mean, I think we want to notice where there has been significant improvement, and I pulled out eating disorder. There are some areas where there has been significant improvement. I think that we know that it's been a very challenging year. Performance hasn't particularly deteriorated, but there are also significant stubborn areas where it hasn't improved. I think we are pleased that we met our target around retention. We said 15%, we're at 15.7%, and that clearly has involved a huge amount of work to get us there. And I think we should thank the people involved in helping us to get there. But there was a question then about how we benchmark and how we learn as we're going forward. I think there are also those things that we talked about where we know that complaints response rate is improving, care plans are improving on a trajectory, but there is something about not normalizing things. I think that, there was a time when we wouldn't have accepted anyone waiting who was medically fit to discharge. And there's a risk that 1 year we normalize 80, then we normalize 120. And so there is something about trying to find a way of opening up the conversation that recognizes the pressure we're under, but also actually really just think, are we actually doing everything we possibly can? And how do we incentivize and encourage teams? So I think, we are where we are at the end of the year, but we want to come back quickly on the front foot with some of those big challenges and to see whether we can come at those again. Joe, did you put your hand up again?
Yeah, just a quick one in terms of accuracy. In some of the tables, it says actual Feb 2022, and I think they should be 2023, and then it switches over to 2023. So could someone please have a look at that, because it's not correct.
Okay. Well, that took the wind out of my sails. Thank you. We'll do that. All right. Is there anything else on the integrated performance report? Lovely. Thank you very much indeed. Can we move to the quality committee report?
Thank you, Chair. So I wanted to note that we welcomed Teresa to her first meeting of Quality Committee, our last meeting. We also noted I think the positive developments around restructuring of subcommittees, recognizing that we've got some way to go, particularly around kind of improving governance and assurance. I just wanted to bring to your attention, sort of, I suppose, first of all, at the micro level, I think we really welcomed the desire to improve understanding of service user experience. And we had a report on a focus on out of area placement feedback from 41 service users and what they wanted. And I think that's really good. The Quality Committee should be getting that kind of really granular feedback from people who use our services and thinking about how we learn from that. On the macro level, I think we're really, pleased about the development of, the integrated dashboard, some of the things that we've been talking about earlier today, more information, more data on experience alongside the performance data. So I think that's really a positive development. We also spent quite a lot of time on the complaints handling that you've heard about today, and discussed, changing the target from 35 to from 20, moving it from 25 to 35 working days, and what that would mean in terms of our service users, their families, how we communicate that clearly to them, why that's actually going to be beneficial to them, in terms of managing expectations, being honest and doing better on quality and tone of responses. So I think we spent a lot of time on that, and we're content with the recommendation from the exec team to go in that direction. And then I think we felt on both on suicide prevention work, which already you've seen today, and on clinical effectiveness, which we've touched on, we recognise again that more work needs to be done, but the direction of travel is right, and we're getting to grips with the issue of metrics and outcomes now in a way that I think we haven't previously. And finally, just welcoming the change in the CQC rating on Lindridge, and well done to everybody there for all the work that's gone on to achieve that. So very happy to take questions. That's all from me.
Thank you very much, Anna. Are there any questions for Anna? Doesn't look like it. I mean, I think we probably picked up quite a lot of the questions when we were looking at the breakthrough objective. I think that's where we did quite a lot of that exploration. I mean, I think it's fantastic that you've got a bit more confidence. You've got the right outcome measures and the right metrics.
Yes, I think it's going in the right direction. I think we it'd be fair to say that we stalled a bit on effectiveness for a while, but I think we're getting there. I can see Kevin's got his hand up, and I know Carrie feels, she's been very involved in this a lot. I think I wouldn't say we've landed that yet, but we are getting there.
We're in the foothills, aren't we? I think we've got we possibly have the beginning of a plan, and I think it is something we've all agreed we need to really, really focus on this year. And I think we understand the complexity, at least we understand how complex it is. Yeah. But I wouldn't say we're anywhere near there yet.
No, but I do think that the narrative is changing towards integration, clearer understanding of the experience of people who use our services, and then that coming through into effectiveness. So I think that's, it's not just about, we talk about clinical effectiveness. What does that actually mean? Because it has to be meaningful for people who use services as well. And if it's not, then we need to change the language so that it is. And I think that's why it's difficult, and why we're moving slower than we would like, but we're going in the right direction.
Okay. Any other comments or questions for the chair of the quality committee? Teresa, was there anything you wanted to add?
No, thank you, Chair. I think Anna's covered everything. Thanks.
All right, thank you very much. So in which case, can we move to the annual plan, Usman?
Thank you, Chair. The annual plan brings together clearly lots of different components, both there's a finance element to it, workforce element, all of the bits to it. I'm actually going to hand over to Colin, who's going to talk to our annual operating plan today. Okay. And then I think where there's questions, we might go to the relevant exec leads for those sections, if that's the easiest way to do it. So if that's all right, Chair, I'll hand over to Colin.
Okay, thank you.
Thank you, Chair. Yeah, so this is obviously our draft annual operating plan for 2023-24, recognising that obviously in terms of our system planning, we're still very much involved with partners in terms of developing the overarching system finance, workforce and activity plans, so very live at the moment. I think this is an opportunity to think about how we align our contribution to the system plan, which is very much focused on workforce, finance, performance and activity, but think about it through the lens of our overall kind of sort of breakthrough objectives as we've been discussing them over the course of the last sort of few months, and how those then sort of align in terms of the delivery of our overall kind of sort of vision as an organization. It is a sort of a kind of a consolidation of several different sort of sections of information. You've got the sort of the expected parts in terms of the bits I've just referenced around kind of finance, workforce, activity, but really trying to think about how do we set this in sort of the context, the national context, as well as some of the local contextual pieces, some of the work that we've had done recently where we've engaged Deloitte and PSC to come and offer us some additional independent views and expertise. And then also, how does that sit with really keeping kind of quality at the fore of what we're talking about? So deliberately putting quality before finance, workforce and activity. And then also making reference to some of the key areas of transformation that we've currently got underway, recognizing that there's an awful lot more work to do in terms of sort of agreeing with system partners exactly what our key sort of system priorities are for 23-24, and then how SPFT's element of this aligns. It is a sort of a slightly different format to previous years. So previous years, it's been a sort of a relatively long sort of Word document, trying to kind of sort of keep the sort of the alignment between when you look at things like our financial recovery plan, our objectives, and this obviously trying to just think about sort of synergy in terms of sort of format and sort of presentation style. So hence the reason you're seeing it this time as a PowerPoint presentation as opposed to a kind of formal Word document. I don't propose to sort of say anything more in terms of sort of introduction for it, other than obviously open it up for questions and comments, and then draw colleagues in as relevant in terms of the different individual sections.
Okay, thank you. Are there any questions or comments for Colin? Anna.
So I mean, I really welcome this. I think, you know, I mean, the volume of work is just, you know, incredible, and I just can congratulate you on pulling this together. And I think this format is really helpful to us. I think the one thing I just want to pick out, and it kind of goes back to thinking about staff well-being and feedback on the staff survey and how we bring people with us, that I just would like to see a little bit more in here about co-production with staff, as well as involvement of people who use our services. So, you know, things like, so page 8, you know, the management of ligatures, you know, it talks about meeting structures. I think it's about just weaving in a little bit more to say, we're doing this with you, not to you. If that makes sense. Yeah, so you know, so on page 20, the piece of, you know, we talk about outcomes, you know, we could even just changing it to say co-produce the thematic analysis would feel to me a little bit more inclusive, because I think, you know, lots of what we've heard about today, you know, when you talk about QI and you're talking about, you know, giving people permission to do things at a local level, you know, within their teams. But I think this document just slightly lacks that sense of co-production with teams and with staff. So just a plea to go through it and look at it through the lens of, you know, for our staff, when they look at this, if they look at this, will they see themselves in there? Will they feel this is something they can engage with and feel part of, rather than it being something that sort of imposed on them? I don't think it's completely that way, but I think it could be pulled a little bit further back into involvement rather than, yeah. Does that make sense?
Yep.
Thanks.
Usman.
Oh, well, I was just going to sort of briefly respond to Anna, if that's all right, Chair. So, I mean, I think that's a really fair challenge, and I think the reality is that we've been having quite a lot of discussions and taking breakthrough objectives around how we want to move into a much more meaningful sense of co-production, in parallel with sort of finishing off the sort of, let's say, something we'd already started kind of approach. And I think there's definitely something for us to take away from here before we finalize this document. How can we make some improvement on it? And without wanting to cause anxiety for anyone, I think actually what we should be doing is thinking about how are we going to meaningfully introduce co-production, the use of experts by experience in the planning of our 24-25 plan, because really that's you know, we need to, I remain ever optimistic about how early we can close this planning process down, but we are slightly held hostage by what the national timetables will look like on this, but hopefully that process will be soon. And then I think we should meaningfully think about 24-25. And actually, how are we going to involve? local communities, local users, people, and make sure that we generate a plan that actually speaks to people. Because I'll be the first to say, there are things in here that you would say, actually, what would that mean? Now, we do it for very specific purposes that we understand, but you could argue there are things even in, my financial plan that probably don't speak to everybody. And I think there's a better way to do that. But I think that, for me, feels like rather than trying to retrofit something into 23, 24, not to say we can't make some improvement, actually, the focus really for me is how do we make sure 24, 25 is meaningfully co-produced?
That makes sense. Thanks.
Yeah. Can I just check, Usman? So when Teresa, as it happens, Teresa was talking about smart plans that sit behind the objectives. What's chicken and what's egg here? This plan is written for a series of regulators, and is the overarching plan from which the smart plans might flow. Is that how we should understand it?
I think so. Colin will articulate it far more effectively than me.
Fine.
But I think one of the things that we've recognized is we have this, which we have done for a very prescribed set of purposes related to the National Planning Submission. But we've also been talking about a recovery plan and a transformation plan. And I think it's how do we have sort of a single plan?
Yes.
And how do we quickly get to the space with that? And that's what I think we as an exec have been trying to do over the last few weeks and bring it together in one document.
Because it's about co-production and clarity of purpose, isn't it? It's
exactly.
Okay, Colin, please.
Yeah, I think
I'll stop speculating and just ask you.
I like the questions being edited by Isman first. No, I think one of our biggest challenges, isn't it, is we have so many different sort of plans and strategies coming in at us as a huge organization, and our challenge, if you like, is how do we synthesize those things into a way that we understand as a board and can assure ourselves in terms of the delivery on, but also how do we then do the translation piece for our workforce so that they really understand these things in a sort of singularity. So I think just going back to Anna's point, absolutely take the points around the language within this. We can definitely look at that. I also think, and I had a conversation with Dan offline, I think there's something about once we've agreed our operating plan, then there's a kind of a comms piece around actually how do we take this and make it relevant for frontline staff who aren't going to sit there and read 36 slides. And actually the relevance of it, if you like, isn't going to be met. And I think we talked previously in one of the strategy sessions around, how do we really bring our breakthrough objectives alive for people rather than this just being an operating plan that sits on our website and isn't used. The effectiveness of this is going to be in terms of its utility. And then the other point I just wanted to make, the point around the kind of the co-production of next year's sort of delivery plan. Absolutely, completely agree with Usman. And I don't believe time is a constraint, because I think good co-production sets the parameters down in which it has to operate. It's not it's going to take forever and a day. And slightly sort of tongue in cheek, if we do that, then we will immediately have delivered on our first breakthrough objective for 23-24, because we have to remember that our first breakthrough objective is setting ourselves the ambition as an organization to really, really embed the principles of co-production, of which, as we go forwards, we now need to make sure that we really live by that. I think we're at a transition point at the moment where we've agreed that that's how we should be doing things, but we haven't quite got to the point where that is how we are routinely doing everything. And I think we really want to see that transition through the course of the next sort of 6 to 12 months.
Thank you. So, Dan, and Teresa, were you coming in on the same point?
I was, Chair, if that's okay.
Yes. So, Kevin, if it's okay, I'll go to Dan and then I'll come back to you. Okay.
I mean, very briefly, and I don't mean this facetiously, but I think the fact we've got the CFO talking about co-production is a genuine reflection of the conversations we're having as an exec team about quality. For me, building on what Colin was saying, the delicate tightrope we need to walk, and it is walkable, is to achieve authentic engagement, to move at sufficient pace where we need delivery, and to avoid cosmetic co-production where we say the words but it's not reflected on our behaviours and actions. I absolutely think it's possible to achieve all three, but it needs careful thought from the team and the board as a whole.
Thank you very much, Dan. Kevin.
Yeah, really helpful additionality from Colin, in particular around how we're going to do this. I mean, this is almost like a theory of everything, isn't it? This particular plan, but it's very much a here and now, the next 12 months, what we're going to do. And I think that the deeper themes we've spoken about is kind of getting ready, isn't it? Getting ready for the bigger transformation, if you like. And I think it's really impressive, actually, what we produce. It really looks absolutely amazing. There's question around deliverability and about assurance around how we can do it. As long as we've got our heads up, though, and we're looking to this really as a holding year, and we're creating the conditions where more change can happen next year. I think it's really good.
Thank you very much, Kevin. Teresa.
Thank you. So linked to what we've heard from staff in the staff survey around how valuable they find their supervision and or appraisal, we had a conversation in the integrated assurance meetings with the CDSs last week about supervision and appraisal. And we started to get to a place where we were saying, not as sophisticated as I think we're now getting to through this discussion, that through the annual planning, we will then build in for people through their appraisal, through their individual objectives and the personal objectives, something that links to the annual plan, so that there is a flow and that everybody owns something associated with the annual plan according to their role. So I was just kind of working that through in my thinking for the first time, connecting this conversation together. And I land at the place that Usman took us a minute ago, which is the reality is that this is probably the 24-25 discussion. If we can land that point around supervision and appraisal for 24-25, that then really brings it to life for people through their appraisal.
Thank you very much. Amanda.
Yeah, like others, can I say, definitely, you know, how much I feel this is a very powerful and very strong paper, totally with the point about, look, there has to be one strategy and one plan, and getting those aligned, and the discussions at the exec level in terms of aligning those, I think it's a very important one. I guess a similar point to what I was making earlier in the meeting, for me, this is all about clarity of what the objectives are, clarity then about what specifically in 23-24 are we going to do that's going to make a difference to achieving those objectives. The measurement point that Joe mentioned earlier about how then during the year do we know if we're on the right path. But then also, and I guess this is the one area maybe that, again, Colin, maybe if you're reviewing it, as Anna said, maybe to think about too, is what are the risks as we assess them now, i.e. at the point at which we're approving and you're setting forth on that plan, what are the current risks to the delivery of that? And just asking yourself, based on the information that we already know, based on what we know has worked, what we know hasn't worked, what are the risks now to achieving that plan? And then obviously continue to monitor those as we go through. But that was the one area that I thought maybe just in terms of risk management, it possibly needed just another little bit of read through as well. But it's great, thank you.
And that would feed into the BAF. So the BAF would capture those risks. So we'll look at, now we've approved it, we'll do the BAF probably in May and give it a little bit more oxygen so that we can really think about what the obstacles are. So that's really helpful. Okay. So I think we sense that you know that the annual plan really does set out both how we're going to respond to the challenges we have now and build a bridge through to 24, 25. We recognise that there's more we can do to ensure ownership, to avoid cosmetic co-production, to achieve real clarity of purpose. I think there's a sense that co-production with staff and patients is who we are. It's not a project, it's actually just who we are, and it's just how we do things. But hopefully as we now risk assess the here and now and develop the BAF, that will enable the board to make sure it's got proper oversight both of the various milestones and whether the risks are being managed and mitigated effectively. But also as we start to plan for 22 or 25, we can carry this through and build on this, so that everyone's got a stake in the plan, and that all the various plans that we have to produce are all feeding through or feeding from this set of statements. I also just wanted to acknowledge, I think the quality section is one of the better quality sections that we've achieved. I think it's really much very clear and very helpful. Thank you all very much on that. Can we now move to the Finance and Investment Committee report, please?
Thanks, Chair. I'll take the report as read. We had a couple of things we discussed, including the sale of the Harold Kit unit and the acquisition of the lease at Portland House, which will come up to the board for approval. But we spend most of the time at the F&I committee discussing the plan, the recovery, and all the stuff that Usman and the team have been working on to get us into next year. So I will leave it at that in case there are any questions.
Okay. Are there any questions for the chair of the Finance and Investment Committee? Okay, I think thank you, Nitin. I think we take your report as read, and we'll then move to Usman in terms of the finance report, which is, I suspect, where we need to focus our time at this point in the meeting. Thank you, Usman.
Thank you, Chair. So I'll take the report as read, but I will go through it in a little bit of detail, just given that we're at the year end. Where have we got to compared to where we said we were going to get to? And what does this then mean for us as we move into next year? Just thinking about the conversation we'll have later around the plan. So you'll be glad to know, I hope, there are no surprises in the finance report. We're going to have an actual deficit of £5.5 million at month 11, which is a £3 million improvement compared to the previous month, and is in line with our delivery to achieve a £4.7 million deficit at year end, which, as you know, is when we changed our position formally at month 10. I think it's worth highlighting that the drivers of that remain the same in terms of the use of the independent sector beds and agency. I think in terms of agency, it's worth highlighting that we are starting to see a shift. We are actually starting to see a reduction in the use of nursing agency, but it is unfortunately being counteracted at the moment by increase in medical agency usage. So I think the important point from me for there and to highlight to colleagues is the work that has started this year around the off-framework agency that started sort of seeing the really significant reduction in off-framework agency usage. We went from 48% earlier this year with forecast to end the year sort of about 17%. So really significant reduction. That work is now starting to translate into some financial reductions, but it is being offset, unfortunately, by, as I said, by the increases in medical agency usage, which will become part of the conversation and planning for next year. In terms of, so that's the forecast, and I think it's just important to recognise that while that isn't the break-even plan that we had originally set, £4.7 million is a really significant improvement from where we found ourselves at month 6, where we were potentially looking at risk of in excess of £20 million. And I think the sort of actions that we've taken, partly supported by going into business continuity, that focus on the independent sector beds, the focus on framework agency usage, all of those actions have helped support that improvement, and hopefully should give us some confidence that we are able to deliver a significant element of our plans when we put the infrastructure into them. Speaking of which, I will move briefly on to give an update on the savings plan. Savings plan started the year at £15 million. Worth noting that we have delivered all of the sort of corporate, non-pay and other savings. So overall, we're going to have delivered about half of the programme, and we've delivered all of the sort of corporate, well, all the element that isn't the beds and the workforce. I should keep it simple and say that. And again, I hope that gives some confidence in terms of as we think about next year's planning, we should have a high degree of confidence that where we identify non-pay, corporate and sort of other related savings, we will likely deliver those. We have a good track record of it. On the beds, we clearly didn't deliver the saving, but I think the trajectory is really important to note. At month 6, we were using 100 independent sector beds. Our forecast expenditure was well in excess of £25 million just on the beds at that point. We're probably going to end the year somewhere in the region of 18 to 19 million pounds of spend on that. We've got a really significant reduction around how we've done that. But clearly that improved trajectory at the end of the year wasn't able to offset the high level of overspend earlier on in the year. But it does mean as we move into 23-24, our exit run rate from this year is in a much improved position. And then the final element I just talk about is workforce. So again, on the saving side, we haven't really seen the financial benefit of what has been an enormous amount of work. But I think it's worth stressing that we have spent a lot of time this year putting in place the infrastructure and the processes in order to be able to manage that all really effectively. So the daily panels around off-framework agency usage, the monitoring and control of it, has significantly improved. And as I said earlier, that's primarily been one of the key reasons for how we've managed to get from a really high rate of non-framework agency usage to the much reduced rate at the end of the year. I think it is also worth highlighting that we've had a really success story around the use of enhanced observations. So a significant amount of our agency spend was on that front. And I think some really concerted effort through the nursing team and lots of colleagues. We've been able to deliver a position that as we move into next year, we are in effect in a position to say we won't need to use any agency staff in HCA roles to around that. And that's the plan that we've gone with. And I think that sort of again speaks to when we put concerted effort, multidisciplinary team around it with good data, we've been able to demonstrate that improvement in the enhanced observations usage and spend on those areas. I'll cut that was sort of just the key points I wanted to draw colleagues' attention to. I won't go through all of the pages of the report, but I'm happy to take questions on the I&E position. Just in terms of the capital and balance sheet, I think the things just to highlight are, we are forecasting that we will deliver against the £8 million local ICS capital target, in effect the spend that we had committed to. We're confident that that will all be achieved. We clearly started the year with an anticipation that we were going to spend quite a significant amount on the Rises programme. However, for lots of reasons during the course of the year that we have discussed through Finance Investment Committee and the board related to the difficulties of getting the cost inflation numbers, the sort of working with our partners in terms of understanding and getting the GMPs and contract prices, it has delayed things. We also had some delays just related to acquisitions of the land that we've worked with partners to achieve, but was a bit slower than we had hoped. On the back of that, we are going to underspend against that programme, but we have agreed with our national colleagues to defer an element of that into next year, recognising some of those challenges that we faced that were sort of beyond our control, as it were. So nothing else to say really on capital. I think it's a really successful capital programme that the Trust has delivered this year. It speaks to the way we over planned in effect at the start of the year, recognising that we prepared to take a level of risk and delivered against it. And the last point just to highlight then, as we think about what this all means for 23-24, it was in the annual operating plan section that I'm sure colleagues will have had a chance to read as well, and we'll talk about this much more in our next sessions. But as it stands at the moment, we're projecting a deficit of about £18 million for next year on the back of a delivery of a CIP programme, cost improvement programme of circa £20 million. We're still working this through. As you'll appreciate, there's been quite a lot of moving parts to this, and we are still finalising, we're still seeking confirmation on a number of areas, but we will come back to this in April for a sort of final board approval post all of the work that needs to happen over the next couple of weeks. And Chair, I'll stop there.
Okay. Thank you very much indeed. And a better position than we were anticipating at some points in the autumn, and we should notice that, challenging as it remains. Dinesh.
Rather, I mean, as a new kid on the block, you may have discussed this before. Just a question to clarify in my own mind whether we have A, potential to reopen some of the ward beds, and B, have we thought about it, and C, are there any plans to do that rather than giving independent sector loads of money?
A great question, Dinesh. Something I've been challenging ourselves on since I've arrived. I think it's fair to say, having done a lot of work with internal colleagues, we are maximizing our internal bed usage. I'm pretty confident saying I can't think of any material number of beds that we would have available to open.
I think you keep cutting out, Usman.
Oh,
I can't hear you. I don't know if others can.
Can others hear me?
Yes.
Dinesh, apologies. Is that any better? Can you hear me?
Yeah, that's a lot better.
So just to say, we don't have any material number of unused beds within the organization. So I think our challenge in terms of opening additional internal capacity would be really difficult. We don't have the physical estate footprints for it. I think our bigger challenge would be we wouldn't be able to staff them. We struggle to staff what we currently have at the moment. And I think as set out in the annual operating plan, as set out as part of our objectives, one of our big challenges as we move forward is to become less reliant on bed usage, move to a much more out of hospital focused offer, and understand what it would take for us to transform those services, i.e. how we do it, but also support an increase in staff within those services so that we have less reliance on people using our beds. Now, it's easy to say that and much more challenging to deliver, as I'm sure Aruna and Teresa and John will attest to, that I think has got to be the basis of our sort of plan going forward, recognizing that it will cause challenges as we are today. And I think we talked about it in the IPR, and it's always good when you're having the finance conversation and everything else you talk about has been talked about through the agenda. But it is hard, we're going to continue to have these conversations with our local authority partners around those MRD patients and those beds, because we have got, I think, the number of beds we need if they were all available to us. And I think that's the challenge for us. And I think that is something that we're going to have to continue to work and be creative. And as Peter said, we can't get into this position of sort of normalizing that rate of MRDs, and we may have to be creative in thinking about what we could do differently and how we would step into certain spaces that we might previously have not wanted to. But yeah, that would be my sort of where I think we need to go on the beds. Sorry, a long-winded way of saying I don't think we have any more internal beds, and our focus is on the sort of community in order to avoid the use of those independent sector beds.
Thank you.
Thanks, Dinesh. I think the board is always looking for ways to reduce its dependency on, but out of trust and out of area beds. So I think it's something we need to keep bearing in mind. How can we reduce that dependence given the cost attached to it and some of the quality issues that sometimes come with it as well. Is there anything else on the Finance Committee report? No? Okay, thank you. Audit Committee report, please.
I will take, thank you. I'll take the report as read, and I'm open to questions if any.
Thank you. Are there any questions for the Audit Committee Chair? No. Thank you very much. I came to the Audit Committee on Monday.
Last Monday.
Last Monday, and I was really impressed at the way in which the flow. It seems like the flow of information is now working from finance and investment and quality through to audit, and then the way in which the audit plan is being developed. I think that's going to really help us, and particularly once we've done the BAF for next year. It feels like that system is working really well. Do you feel it is? Good. Freedoms to speak up. Hello.
Chair. Hello.
Hello, Jackie.
Can you hear me okay?
I can.
Lovely, good. Okay, shall I get going? I shall assume the report's been read as well, but just acknowledge that since I've written it, I've had access to the staff survey results for last year. So we've just done the new staff survey, but these are the results from last year, which I think suggests a more mixed picture, although of course we don't know how things are currently. So my report's very positive about the numbers of people speaking up, increasing quarter on quarter. And at the end of quarter 4, which is this week, I can let you know that we've also seen a continuation of this increase. So double the number of people will have spoken up to The Guardian this year compared with the last financial year. So that's over 140 people. So a lot of that's very positive. And I think a lot of the promotional work mentioned in this report's very positive. I suppose I just want to acknowledge, though, the last year's staff survey, which is not so positive, quite the opposite. So I just want to let people know, you may know already, but our results were previously average compared with other mental health trusts, and we are now slightly below average compared with other mental health trusts. So our confidence in speaking up around patient safety or any issue in our staff survey is lower than it was the year before and the year before that. And although it's only a small change, it is statistically significant, according to those who published the staff survey. So I think we always need to be mindful, and as I say, I don't know what it is this year, but we do need to be mindful that maybe the experience I receive as the Guardian and the people speaking up through me may not reflect the whole culture within the organisation around the confidence in speaking up. And I think it's something that maybe as the exec we'll need to discuss with me and others about how we make sure that we're on the right track going forward this year. I think the staff survey results, they are poor across the whole of the NHS, by the way. It's gone down across the board, so we're not alone in things getting worse. The picture's deteriorated nationally. But if you look at the national intelligence, and I hope people have had some time to have a look at some of these amazing reports that have been done, they tell a very familiar picture and a very familiar story when you think about speaking up being set up after the scandal in Mid Staffordshire. A lot of those themes are still around month in, month out with the different national reports that get published around the NHS in general. So I don't want to sound too miserable because there's lots of positive stuff going on, including our training and all those kind of things. But I also want to be honest about the work that we might have ahead of us. So I'll throw it open for questions.
Okay, thank you. Are there any questions for Jackie? Anna?
So thanks, Jackie. And I mean, there's a couple of things I want to say. Firstly, I want to just say how incredibly fortunate we are to have you, along with the 23 champions that you work with. And I just think the work you do is fantastic and so important and links into so much of what, we as a board and as a trust are trying to do. So I think that sort of really important question about what more can we do for staff to support them should sort of be a bit of a golden thread, really. I suppose the one thing I think you've painted a really clear picture of the increase in, which is great, the increase in the numbers, but actually we've got some worrying kind of trend lines there that we need to keep an eye on. And I think, particularly around people feeling safe and the issue about inappropriate behaviours coming to the fore more. And so my question, Jackie, is, and this kind of comes from a session I was at with other Freedoms to Speak Up colleagues, was this question about how do we understand who in our patch is able to speak up and who is not, because I think that issue about the confidence to come forward is really important. And I just wonder whether that's a conversation that we can have. I thought it was quite a good framing, you know, who is it that feels okay about this and who isn't, and why, to just bring that into our conversations a little more might help to make sure that we are seen as an organisation that really does want to listen to what people are feeling and experiencing.
Yeah, it's a good question, Anna. I mean, there's obviously people who face additional barriers to speaking up and who might face multiple barriers. So I do reference international nurses who may be new to the workplace, new to the trust, new to the country, from an ethnic minority, from cultures where speaking up is not the norm, where countries may not even allow unions, you know, things that we take for granted. So I'm really pleased to be doing a bit of work with Teresa Barker on those. I think we're talking about a very general culture. Obviously, we can work on those specialist groups, but really we're talking about organisational culture. And I think that the National Guardian Network talk about two things getting in the way of speaking up, and they summarise it as fear and futility. And I think we all probably hear those things. We might feel them ourselves. You know, what's the risk of us speaking up and speaking up now? And also, will it make any difference? And I think I hear those things a lot from people who do speak up, and also from people that I meet on my walk around and my site visits. So I think we maybe have to think more, given that many people are speaking up, I think maybe we need to think about, are we listening up? Are we following up? What experience are people getting when they speak up to their manager? You know, there's going to be new training for managers being launched now on the 1st of April. We've got really good compliance around staff feeling confident to speak up. In terms of 70% of people have done that training, but we've got training now for managers and we've got training for execs. So I think maybe some of it's about how we then respond and create a culture of listening and thanking people and not making them feel that they're being difficult. Lots of hands.
Okay. Yes, indeed. Simon.
Thank you, Jackie. And I think you've probably started to address the point that I was going to make, which is, do people believe it's worth it? And I think that we focus on the fear more than the futility often. And so I would be interested, I guess, and recognise it's my first meeting, the first time I've said anything at non-exec, and just from reading the papers. But for my question would be, how do we become a trust which people believe it's worth it? Because I think with that, then when the fear reduces, when you believe that the benefits, you know, the cost benefit shifts. So thank you for raising that point. And for my money, the futility bit is the one to really make sure we're working on, and with that, fear will reduce. And you have to work on that too. But thank you.
That's really helpful, Simon, and I'm sure Claire is ready to answer that question. Claire.
I'm not entirely sure I can answer that question, sorry, but what I did just want to add to Jackie's paper, also noting the increase in reporting, which I think has been really helpful over the past year and should be applauded. But the two things I just wanted to add, one was I was at a session yesterday for executive sponsors for Freedom to Speak Up, and there was a lot of discussion about the difficulties with speaking up and the complexity with the overlap of that with HR processes, and how quite often that does make it difficult for people to speak up, and that element of futility, because we know HR processes are difficult for people to engage in and quite often can be frustrating or challenging for people in terms of seeing the outcome that they think should come of it. The second thing I just wanted to mention, which is a really, really positive development, is some of the team were successful with a bid through our charity for a night worker, where we will have someone going out and engaging specifically with our minority ethnic staff, where we know we have a greater proportion of people who work nights, to work with them, to encourage them, to support them, so that we hope that that will lead to some really positive outcomes in terms of people feeling able to tell us what's really going on, understanding that night culture, you know, really building that workforce.
Thanks, Claire. Dan.
Thanks, Chair. I'm afraid I don't have the answer to Simon's question either, but I think it's an excellent question. I just wanted to say two things. Firstly, Jackie, to thank you for framing this discussion in relation to the staff survey, because I feel really strongly an important part of taking feedback seriously is to name where it tells us we need to do better, and that is an area where we do need to do better. I also completely agree with your point about organisational culture. I was struck by something I was reading quite recently in relation to mid-staffs, where it talked about the narrative of silence that had built up within the organisation that all was well, and part of the problem was that the organisation, for whatever reason, wasn't hearing feedback that was coming from patients, families, and from staff, which in my mind takes us back to the discussion about the quality plan earlier. But thank you, Jackie. I thought it was an excellent report.
Yes, thank you. Thanks, Dan. Kevin.
Hi, Jackie. How are you doing? Yeah, a really good report, and thank you for doing it. I guess my question is, do you feel you have what you need? Actually, I'll frame it differently. The themes and things you've picked up over the past 12 months, and do you feel as if you've had the ability to do something about them, and the ability to make change, if you like? And what more support do you need to make your job even better than it is?
Yeah, I think a lot of people speak up about issues that actually aren't quick fixes. I think where people bring something very specific, there can be a very quick resolution. I think, like Claire's alluding to, a lot of issues people bring are related to vacancies, long-standing cultures in teams and conflicts, and they're not easy to fix. So I think for me, it's about getting the whole organisation thinking about speaking up and how we respond at all levels, because I think that there's probably lots of different levels where people are speaking up and they're not being heard, sometimes potentially at quite a low level. And actually, the training I think is quite important, because it just sets the boundaries as to what's expected of those listening. So it's about how we all listen up more. So I don't think it's something I just instantly need. I do think, having gone to a National Guardian conference, there's more investment in their guardian functions. There's lots of big trusts have groups of guardians, and they think about the fact that lots of organisations are spread over lots of places. So I do think we might have to, as it says in the report, have a look at our resources over the next year or two. But I wouldn't put that sort of top of the list right now.
Okay. Thanks very much, Kevin, and thank you, Jackie. Jackie, thank you very much. It's an excellent report. You've been absolutely right to highlight some of the things through the staff survey, which you'll be pleased to hear the board had also picked up in other parts of its conversations. I think we're obviously pleased to see an increase in reporting. I think on balance, we think an increase in reporting is a good thing, because as Dan says, you don't want to get to a point where there's a culture that people aren't speaking out. The chief executive and the chief nurse have talked often about the need to listen to the whispers on the wind, and clearly you are part of our system for trying to make sure that we do listen to the whispers on the wind. We really welcome the efforts you're making to improve access and accessibility, but also I think we would like to understand over time that actually the other point you're making, which is about futility. And actually, do we have a sense that people feel it was worthwhile, and that actually they got what they wanted out of speaking up? Clearly, this is one bit of our desire to improve staff well-being, to improve morale, to improve retention, and this is a really important part of that. And we need to look at it in the round and understand exactly how people feel it is to work here, and that when we say we're going to do something, they have some confidence and trust that we mean it. Keep holding us to account. Keep speaking truth to power, and good luck with the work that you do. Thanks, Jackie. I have one item of any other business. Does anyone else have any other items of other business? Okay, so my item, Amanda, is you, because we need to acknowledge your time with us is coming to a close. You're coming to the end of your term. and you've decided that that's a point at which you'd like to step off. I've said to you before, and I'll say it again, I don't think anyone could have joined an organization at a more difficult time. I think you joined the week of the first week of lockdown was your first week. So we all went online just as you joined us. And I can't remember how many months it took to actually meet you in person. And I think to come into an organization in that environment was really, really difficult. And I think that you do bring a very particular determination to follow something through, and you have really held us to account. And I think trying to get us to a point where what we're demonstrating is meaningful, that we've got meaningful outcomes, that we've got meaningful measures. I hope that you can look at us today and see that we're in a very different position from where we were when you arrived. And I hope that you do give yourself some credit for the fact that you played a really big part in that, both in Finance and Investment Committee and at Audit Committee and in the main board. But of course, I mean, they are equal, but of course it wouldn't be right not to also thank you for all the work you've done for Heads On. I think Heads On is transformed from where it was. And I know that Rachel particularly values your contribution. We now have a much clearer strategy. You've upped our ambition. Well, I think you've probably written, but you've certainly supported the writing of a number of very successful bids. And I think that also is something that I hope that you're very proud of, and certainly we are very grateful to you for. So thank you very much, and we wish you best. And we wish you the best.
Thank you, Peter, and I appreciate all those kind words. And you're right, particularly for someone who's not been involved with the NHS at all before. It was like moving to a foreign country and doing so online. And I can't thank everyone enough who's helped me navigate the last 3 years. It's definitely been an interesting experience. I'm relieved to hear that you feel I have been of some impact. But thank you to everyone who's made that process, as I say, so smooth for me, or as smooth as possible. The main thing I'm going to miss are the people. I know there are plenty of new faces on the call who weren't with us 3 years ago, and that's really exciting. But likewise, some very familiar faces now, and I hope in many cases this isn't goodbye, that we will find a way to work together in the future. I'm certainly very keen to find ways that in my continuing wider work that I can really champion the work of the Trust. And I know particularly, Colin, you have interest in exploring some avenues with that too, so that would be brilliant. But thank you. It's been definitely a unique experience, but a very, very valuable one. And I think the patient story today really reminded, as it does to all of us, but it certainly reminded me again about the challenges that are ahead for everyone, but also the amazing work that the Trust does. And I wish everybody the very, very best. And thank you again for the 3 years, and look forward to staying in touch.
Thanks very much, Amanda. Can we stop the live stream, please?